I'm going to talk about foods, 7 foods that are bad for brain health and that can set you up for cognitive decline and dementia.
Meet Dr. William Lee, a renowned physician, scientist, and global expert in using food as medicine. As the author of the New York Times bestselling book, Eat to Beat Disease, Dr. Lee has revolutionized the way we approach health. His groundbreaking research has played a key role in developing over 30 new medical treatments, helping manage more than 70 diseases including diabetes, heart disease, blindness, and obesity. In today's video, Dr. Lee will uncover 5 worst drinks that could be silently contributing to dementia. From everyday beverages to popular favorites, he'll elaborate how these drinks impact your brain health and why you should avoid them. Not only this, he will also suggest 3 alternative drinks that have the potential to protect your brain and help prevent dementia. So, stick with us till the end because you won't want to miss these healthy secrets. Before we dive into the list, let's first understand what dementia really is and how it affects your brain.
Now, cognitive decline is something that usually happens before you actually go into dementia. And so this is a continuum of brain health that we're talking about. Okay.
Dementia is a complex and devastating condition that impacts millions worldwide. It involves a decline in key cognitive functions, including memory, communication, problem solving, and judgment. For those affected, it can mean forgetting treasured memories or struggling with simple daily tasks. Everyday routine can become confusing, and once familiar places may feel unfamiliar. This loss of independence can lead to frustration, fear, and isolation, not only for the individual, but also for their family who witness the decline. What many don't realize is that certain drinks may increase the risk of dementia or worsen its symptoms. But before we continue, this content is provided for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with questions about your health or medical condition. Do not disregard professional advice or delay seeking it because of something you have read here. Now, let's explore 5 worst drinks that contribute to dementia. The first drink that negatively impacts brain health is alcohol. Its harmful effects on cognitive function have long been associated with an increased risk of dementia. One of the most severe alcohol-related brain disorders is Wernicke-Korsakoff syndrome, often referred to as alcohol-related dementia. This condition occurs due to a thiamine deficiency, which is essential for proper brain function. Chronic alcohol consumption depletes thiamine levels, leading to memory loss, confusion, and impaired coordination. Over time, this damage can result in significant cognitive decline, further increasing the risk of dementia.
Alcohol stuns and can kill heart cells. Alcohol stuns and can kill liver cells. And alcohol is a toxin to your brain cells as well. There's no situation in which alcohol is beneficial, all right, even in red wine.
Dr. Lee stresses that alcohol, in any form, can shrink the brain, particularly in regions responsible for memory, decision-making, and motor control. Research indicates that excessive alcohol consumption accelerates brain aging, significantly raising the risk of dementia. Beyond brain shrinkage, alcohol contributes to dementia due to its ethanol content. Ethanol is a neurotoxin, meaning it can damage and destroy brain cells when consumed in large amounts. It also disrupts neurotransmitter function, impairing the communication between neurons. This interference can lead to cognitive difficulties, mood imbalances, and motor coordination issues. Additionally, alcohol promotes brain inflammation and oxidative stress, both of which can damage or kill brain cells. Chronic alcohol exposure increases the production of free radicals, harmful molecules that attack neurons and deteriorate brain tissue. Over time, this cellular damage plays a significant role in the development of dementia. Beyond its direct effects on the brain, alcohol also contributes to other health issues, such as liver disease and cardiovascular problems, which further elevate the risk of dementia.
Your liver is the detox for your body. All right. Your liver purifies the blood, detoxifies the blood, Actually, all the blood runs through the liver for this cleaning property. And when alcohol poisons the liver, it's called alcoholic hepatitis, and the liver cells die, and the liver becomes a scar. All right, like a hard scar, like on your skin when it heals, if you have a scar, well, the whole liver becomes that way, or parts of the liver become that way. You compromise the ability for your liver to do the detox.
The liver plays a critical role in detoxifying the blood, but long-term alcohol abuse leads to liver dysfunction. This, in turn, can cause toxins to build up in the body, leading to further damage to brain cells. Furthermore, alcohol's effect on the heart and blood vessels can lead to stroke, which is another major risk factor for dementia. Next, let's take a closer look at how diet soda can contribute to dementia. Many people turn to diet soda as a low-calorie alternative to regular soda, hoping to reduce sugar intake. However, few realize the potential dangers hidden in this seemingly harmless drink. If you're one of them, don't worry. You're about to find out. So, what exactly makes diet soda a threat to brain health? The answer lies in its artificial sweeteners, particularly aspartame. While these sweeteners are marketed as a healthier substitute for sugar, they may actually do more harm than good, especially to your brain.
Artificial sweeteners like aspartame, sucralose, xylitol, erythritol, saccharin, these artificial sweeteners, which are found in a lot of these types of products, they don't actually give a caloric load, okay, in our body. So when we eat them, we don't absorb them and they get stored as energy. But what they do is they tumble down to our gut, and guess what? They feed our gut bacteria, and our gut bacteria does not like them. They're toxic to our gut bacteria. They actually damage our gut bacteria. Remember, we talked about this earlier. When you damage your gut bacteria, now you're damaging your ability to lower inflammation through your gut. You're damaging your ability to support your immune system, which can prevent you from getting infection. And among other things, it damages that messaging between your gut and your brain.
Aspartame, one of the most commonly used sweeteners in diet sodas, breaks down into harmful byproducts like formaldehyde and methanol, both of which are neurotoxins. When consumed regularly, these compounds can cross the blood-brain barrier and accumulate in brain tissue, potentially leading to cognitive decline over time. But aspartame isn't the only concern. Saccharin, another artificial sweetener frequently found in diet sodas, has been linked to negative effects on brain health. It can disrupt the gut microbiome, which plays a crucial role in maintaining healthy brain function by regulating the gut-brain axis. There is yet another concern. Artificial sweeteners can disturb your dopamine production. Dopamine is a neurotransmitter essential for memory, mood regulation, and cognitive function. Consuming aspartame can interfere with the delicate balance of brain chemicals, potentially contributing to long-term cognitive decline. Moreover, frequent diet soda consumption has been linked to headaches, migraines, and impaired learning ability. Over time, these disruptions can accumulate, leading to permanent damage to brain health. Knowing all this, will you reconsider your diet soda habits? Let us know in the comments. But before we move on, if you are looking to dive deeper into the diet to prevent cognitive decline, be sure to subscribe to the Vitazen Health newsletter linked below. Each week, we share expert-backed tips, delicious recipes, and actionable steps to help you live longer and feel your best delivered right to your inbox. Another drink that can severely impact cognitive function is energy drinks. Widely consumed for a quick energy boost, especially in high-pressure settings like school, work, or fitness routines, their potential harm to brain health is often overlooked. Understanding the ingredients that make these drinks dangerous is essential for protecting long-term cognitive function. One of the biggest concerns is caffeine, which is present in dangerously high amounts in many energy drinks. While caffeine can temporarily enhance alertness, excessive consumption overstimulates the brain, leading to increased anxiety, sleep disturbances, and even long-term cognitive damage. Chronic sleep deprivation, often caused by high caffeine intake, is linked to brain inflammation and a heightened risk of neurodegenerative diseases like dementia. Another major issue is the excessive sugar content found in many energy drinks. While glucose is essential for brain function, Frequent spikes in blood sugar levels can damage brain cells by triggering oxidative stress. Over time, this damage may impair cognitive function and increase the risk of dementia.
That is a sugar sweetened beverage, again, contributes to the increased risk of metabolic syndrome and dementia because it's damaging to the brain over time. Again, having a little bit every now and then, not a big deal. Having a lot regularly, you got a problem.
Additionally, many energy drinks contain artificial additives and preservatives, which can be harmful to the brain. Some of these chemicals may lead to neurotoxicity, accumulating in brain tissue and disrupting neural communication. This interference weakens the brain's ability to detoxify itself, potentially contributing to long-term cognitive decline. While energy drinks may provide a temporary burst of energy, their negative effects on brain health, memory, and cognitive function make them a dangerous choice in the long run. The fourth drink that can damage your brain might catch you in surprise. Well, it's coffee, but only if taken late at night. But how?
But if you have coffee at night, caffeinated coffee late at night, it's good. The caffeine in your system is going to keep you up and interfere with your ability to get good quality sleep.
Let's start with caffeine, the key ingredient in coffee that keeps us alert. As a stimulant, caffeine works by blocking adenosine receptors in the brain. Adenosine is a neurotransmitter responsible for making us feel sleepy, so when caffeine prevents it from doing its job, we stay awake and alert. However, consuming caffeine late at night can disrupt natural sleep cycles, preventing the brain from getting the rest it needs. You might be wondering, what does sleep have to do with dementia? Well, research has shown that chronic sleep deprivation can lead to the buildup of beta amyloid plaques in the brain. These deposits one of the key hallmarks of Alzheimer's disease, the most common form of dementia. When we don't get enough sleep, the brain has less time to clear out harmful proteins, leading to their accumulation over time. So, while drinking coffee late at night might seem harmless in the moment, consistently disrupting sleep could have serious long-term consequences for brain health. And that's not all. Caffeine doesn't just affect sleep, it can also impact brain structure. Studies suggest that excessive caffeine consumption over time may contribute to brain shrinkage, particularly in areas related to memory and cognitive function. And there's even more to consider. Beyond its potential role in dementia, drinking coffee late at night can increase anxiety and stress levels, both of which can be harmful to brain health. When your brain is constantly wired and unable to relax, it doesn't get the recovery time it needs to function at its best. Over time, chronic stress can impair memory, concentration, and overall cognitive sharpness, making it harder to focus and retain information. While coffee has its benefits, timing and moderation are essential for safe consumption. Last but not least, sports drinks can be surprisingly harmful to brain health. While they are often promoted as a great way to stay hydrated, not all sports drinks are as beneficial as they seem. Many contain ingredients that, when consumed regularly, may contribute to serious health risks, including an increased likelihood of developing dementia. One major concern in sports drinks is high fructose corn syrup, a cheap sugar alternative used to enhance flavor. Research has shown that excessive sugar consumption can lead to insulin resistance and chronic inflammation. Since the brain depends on glucose for energy, insulin resistance can impair its ability to process glucose efficiently, potentially contributing to cognitive decline and increasing the risk of dementia. Another problematic ingredient in sports drinks is artificial sweeteners, such as aspartame and sucralose, which are commonly found in sugar-free or light sports drinks. These chemical sweeteners have been linked to neurological disturbances and impaired cognitive function, raising concerns about their long-term impact on brain health.
Artificial preservatives, artificial coloring, artificial flavoring, and artificial sweeteners as well. All these things can actually be in ultra-processed foods, and it's really bad.
Additionally, artificial food colorings like Red 40, Yellow 5, and Blue 1 often present in sports drinks have been associated with neurodevelopmental issues, hyperactivity, and reduced cognitive function. These synthetic dyes, derived from petroleum, may pose hidden risks to brain health over time. Lastly, the high sodium content in many sports drinks is often overlooked. While sodium is essential for electrolyte balance, excessive intake can contribute to high blood pressure, a well-known risk factor for dementia. Despite their marketing, sports drinks may do more harm than good when it comes to brain health, making it crucial to choose hydration options wisely. Excessive use of these drinks can be potentially dangerous for your brain and cause dementia. Remember, moderation is the key to a healthy and balanced life. Before we dive into 3 drinks that can help prevent dementia, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by dropping your comments in the comments section. According to Dr. William Lee, certain drinks can play a crucial role in protecting the brain and reducing the risk of dementia. One such drink is green tea, which is packed with antioxidants and polyphenols, especially epigallocatechin gallate. This powerful compound can help shield brain cells from damage, lowering the risk of neurodegenerative diseases like dementia. Additionally, green tea's anti-inflammatory properties may enhance brain plasticity, improve memory, and slow cognitive decline.
Clinical studies have also shown that green tea can reduce anxiety, again, that calming effect of L-theanine, and calming anxiety is actually really important for self-care, really important for mental health and mental wellness.
Another brain-boosting drink is turmeric golden milk. Turmeric contains curcumin, a potent anti-inflammatory compound known for its neuroprotective effects. Curcumin can cross the blood-brain barrier and has been shown to reduce amyloid plaques, one of the hallmarks of Alzheimer's disease. When combined with milk and black pepper, golden milk can be a powerful elixir for brain health and dementia prevention. Lastly, berry smoothies are an excellent choice for maintaining cognitive function. Berries such as blueberries, strawberries, and blackberries are rich in anthocyanins and flavonoids. These antioxidants can support brain function and help prevent age-related cognitive decline. Regular consumption of berry-based smoothies can enhance memory, protect brain cells from oxidative stress, and reduce inflammation, making them a delicious and effective way to support long-term brain health.